You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you. Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcasts, and I have Howard David Stupak, MD. He specializes exclusively in cosmetic and reconstructive surgery of the face, the head, and the neck. He's board certified by the American Board of Facial, Plastic, and Reconstructive Surgery. He's a member of the American Academy of Facial, Plastic, and Reconstructive Surgery. He's practiced in Connecticut since moving here with his family from New Orleans in 2005, and he's known for a delicate technique and natural appearing results, in contrast to some of the horrific celebrity plastic surgery that we've all seen out there. So, Dr. Stupak, thanks for coming. How you doing?
Yeah, no, I'm good. Thank you.
Yeah, before the call, I was actually looking on your website and your blog, and you had an article that talked about, how you're fascinated by seeing celebrities and the plastic surgeries they've had and, the failures of it. Maybe we can start with that. It's kind of a strange irony. The people that most desperately want to look good and have the most money to do it, and you think would get the best plastic surgery, don't, and they look weird and misshapen. And what's behind that? Why does that happen?
Well, I think like many things, it is a error in strategy more than, most people assume that there's, some technical error that happened. Something must have slipped, or he did too much or too little, or a lot of doctors even will blame the patient and she wanted me to get rid of everything, so I did, and now they look disfigured. In reality, it's mostly that we really, as a culture and as a specialty, think about it completely backwards. So when I say our strategy is wrong, it's that, the strategy to most people, which makes sense and is repeated, is let's get rid of wrinkles. So we go, if we get rid of wrinkles, then we'll be looking younger, because everyone knows wrinkles are associated with age. So we become obsessed with trying to numerically reduce wrinkles. So if they think if you have 100 wrinkles, you look old, and if you have 2, you look young or youthful. But the error is that it's not true. You just look bad without. Everyone has lines and wrinkles, and it's associated with age. But what they compromise is the position of everything. So instead of trying to focus on wrinkles, what we try to focus on to not get those terrible celebrity outcomes is cheek position, brow position. And those are the ways that nasal, not just not having a bump or having a cute nose, but having it match the facial structure and the position of everything. I think we need to throw out the whole wrinkle thing out of speech practically, and then there'll be a lot fewer problems.
Yeah, it makes sense. Do you think that the best thing to do is for someone to look good but also look their age? And do you think that it's because celebrities, for instance, want to look younger than they physically are dramatically, and that just leads to, something not looking right about them? Yeah,
I have a kind of also a different viewpoint on that as well, in that it's not the celebrities who are making the error. It's they're going into this going, hey, I want to look good, and they've also heard this whole strategy of preventative care. So they go, all right, I want to prevent looking worse. So they go to a plastic surgeon or a dermatologist, and they're given a treatment procedure. So they say, oh, well, we can prevent aging with Botox, or we can prevent it with these fillers or something. So the person has a different, they just see, maybe a little tweaking, a little better. The problem is the plastic surgeon is focused on a procedure, which by definition means steps. So they're really, I have to do these 7 steps in injecting the Botox or filler or facelift, and they're not really making sure that their overall strategy is aligned with the celebrity, and it's essentially just a miscommunication. A lot of times the celebrities, a further miscommunication, I think it's from basically having a slightly insider view, they tend to go to people who are really good self-promoters, doctors. So they're really good at self-promotion, they're really good at networking, and they may not be so they'll network to become, quote, the best guy or the best celebrity plastic surgeon in Beverly Hills. The problem is that doesn't correlate with a thoughtful strategy. So, in other words, they're two completely divergent things, and it sometimes is the person who has appropriate strategy and empathy for these people. You got to look at, they're being disfigured, so someone's lacking some empathy in how they're treating them. That there's a major miscommunication going on, and I think it's a disconnect between how good a plastic surgeon can make himself seem online and how much of a thinker they are and how much empathy and honesty they have.
Well, I think this is a problem with a lot of professions is, as a consumer that doesn't know anything, like if I want to get plastic surgery, for instance, how do I know that, you're going to do it the right way and some other guy is not, or some other gal? Like, what things would you look at to vet someone?
It's a great question, and it's one of the hardest questions I'm asked, to be honest with you, because people, after I explain this to patients who come to see me, they say, well, why could we trust, you just went through this and said, it's all a sham, the public face, if I'm trying to show how great I am at this, and, you read some stuff at the beginning from an old website that I had, or even an earlier version of my website, and to me, it's very much of self-promotional bull, okay? But that's the world we live in. Everyone, it's really who gets the most patients now is who does the most self-promoting. Every plastic surgeon says they're the best and the most natural and the most this and that. So the problem is when we have this escalation, this arms race of who's showing how great you are, and you have the fanciest website and the biggest office, and you drive a Bentley or a Lamborghini, and you have pictures of you with Prince Charles or George Clooney. Those are the things that we think should be with respect. That's how Tom Hanks is a better actor than most people, because he's achieved those things. The problem with plastic surgeons and with many technical things, none of them correlate at all with skill. So then, you're getting back to the question, what does correlate with skill? What does correlate with getting a good result, or even more important, empathy? Let's say you actually, in the real world, levels of skill are rather similar amongst doctors, even though that's not what the website would have you say. Where does it differ? Why are these disasters happening? I do think it's level of empathy, meaning how much you care to not let yourself harm someone like that. What techniques can you do to mitigate that? And if you don't have very strong levels of wanting to not harm someone, you're going to have bad results, because if you follow the textbooks, things are going to go wrong. The problem is the textbooks are what misleads most people. So you have to be an outside-the-box thinker, you have to have good empathy, and most important, this is going to sound crazy, you have to be a good person, literally. And then how do you convey that on the web? Empathy, being a good person, it doesn't translate into media very well. Howard Stupak is a nice guy. That doesn't come out there very well. So unfortunately, all we have to really really look for people, because again, even education can be a self-promotional thing. I did my residency at Harvard, and people assume I didn't. I'm exaggerating, but if you did your residency at a Ivy League sounding place, it makes people again assume that that's associated with skill. Again, it's not, and you could get very bad outcomes having been to a top medical center. I'm not picking on any specific one. You could get good results having gone to a very average place. So there's definitely a threshold you need to have achieved with qualifications, but the most important thing is really old-fashioned values, like word of mouth. Your sister saw him for the same procedure, a friend of a friend did. You really kind of have to stay local, meet the person, see that they're a good person, have their strategy match your strategy. So you need to have an understanding of what your goal is. If you just walk in and go, I want you to make me look good, it's going to be a failure, because the doctor's not going to know what to do, you're not going to go what to do. I know enough to help someone through it, but you need to tell them what you need to achieve, and it needs to make sense and match, and they need to seem like a decent individual. A lot more than the quote, the kind of qualifications you hear about on Oprah. Make sure your doctor is this, or make sure you ask your doctor this. Those are fake qualifications.
Well, I think I was talking to a friend about suits, and how some suits or some clothing just looks really good, and I can tell you, oh, this suit looks really good, but I can't tell you why.
Yeah.
And beauty and appearance seems to be the same way. Like, I can tell you, oh, this person's looking younger lately. Maybe they're like on a diet or something, but I can't tell you why. And I think I would just guess the plastic surgeon needs to be an artist or a designer. They need to have that sense of how to make someone look natural and look better. Because if they don't have that, then I guess they would just rely on mechanistic techniques they've been taught in school to change someone's facial structure, which will lead to bad outcomes.
Yes, you're 100% right. You hit the nail on the head. If you're the kind of guy, let's say, what we mostly, the way we select people for residency or medical school is someone who can achieve a lot of steps. In other words, they did great on the SATs and the medical school admission exam, and they were able to achieve straight A's, none of which necessarily correlates with aesthetic intelligence or having a good visual eye or being able to grasp these things. So what's interesting is you end up having a whole world of plastic surgeons who can follow a series of steps. Now, if you don't have the eye for it, you're never going to achieve good results without knowing what the goal has to be, and you need an aesthetic eye for that. But you also need to know how to execute. So those two things have to be married together. Both, like you said, the understanding of what does look good, even if you can't put words on it. You have to know what looks good, but you also have to know how to get someone there physically without harming them. So two very difficult things to achieve, whereas following is a series of steps in a procedure is quite easy to achieve. If you think about it, anyone can eventually be trained to follow steps. I think what separates plastic surgeons, and unfortunately the qualifications almost never predict this, is how good your eye is. And I'm not talking about, can you name which work was done by Picasso in 1942? It's literally having that aesthetic eye that you have just by, which we can develop over time. You go, I know that suit looks good. I know I like that girl's look. I know I like that guy's hair. They look good, and you know what you like and you don't know what you don't like. To be a surgeon and achieve those things, or I'm assuming a hairdresser or a makeup artist or a tailor, you have to know what the goal is that is going to be achieved, the aesthetic ideal, and then you have to know at least mostly how to get there, or you're just going to fail. It's a little like if someone watched a sculptor make, let's say a famous sculpture like the Venus or the David sculpture, and someone watched this chiseling or whatever happening, and the sculptor was working, and they wrote notes to each other, and they realized that it was 20 steps to go from a block of stone to the David sculpture. And they wrote down in the 20 steps, and then they bought a block of stone and followed the 20 steps. It's not going to end up looking like the David. It's going to end up looking completely different. They just followed steps, and they were going to be sorely mistaken when they see that it didn't work the way they thought that the steps should lead to.
Right. Yeah, this can't be just a paint by numbers or cut by numbers type thing. Otherwise,
which is unfortunately how it's trained.
Okay. What kind of tools are the latest and greatest? Do you have like 3D computer models of what someone will look like after a procedure? I mean, what kind of things do you use that are helpful?
I'm not as big, I am very interested in innovation, but much less interested in technology. In other words, we can show people generally what they look like. There's a lot of fancy versions of Photoshop out there that are user-friendly, but it's essentially Photoshop, that can simulate. But what you're doing is showing your eye. What I think, if you're really asking me what I think is the future of plastic surgery and innovation, it is changing the educational process, and it is changing from a stepwise person who follows these steps that I think is designed for failure. And if we're all failing at a very inefficient rate, if we're harming celebrities who are by the definition, the celebrated people of our culture, if we can't do that right, we're doing a very poor job. And most people are not calling out that plastic surgery is just in a terrible state, that we can't really achieve very much. But, that doesn't mean there's no good results. There's plenty, but it's hard to find, and it creates unnecessary fear in patients who are seeking it in reasonable places. It creates unpredictable results. So where do I think the innovation would go is to change the educational system, at least into being a much more, and even in medicine in general, to being more reasoning involved and less step following in cookbooks. Unfortunately, the way it's mostly going is more codification of algorithms and cookbooks and steps and malpractice that goes after you for not following certain steps. In reality, I think we need to learn how to be deeper thinkers and have more personality be part of the selection process for medical school, and have it be more looking at artists. And I'm not talking, like I was, just someone who dabbled in art. I mean, really find a way to meld art and empathy and social skills, and we'll make much better plastic surgeons than what we're producing now. And I don't think
go ahead.
Maybe
this is a strange idea, but do any plastic surgeons you know of have like a makeup artist or an artist on their team that looks at the person and works with the surgeon and says, yes, do this, but do that and change this and change that? And would that be helpful?
Yeah, I mean, I think any communication about that would be helpful. And the problem is I think plastic surgeons do think that we also think we're great. So we also think we know all the answers. So yes, having that discussion would be awesome. Having an esthetician who understands the eye, if you don't, is good, meaning the aesthetic eye is good. The more I actually think better communication and less discussion of, quote, procedures and steps would be important. So what you're suggesting is a step in the right direction.
Okay. In terms of patient expectations, do you find that it's very difficult to manage them? Do you have, maybe like these celebrities we all, look at, maybe they're like totally unreasonable. They say, I have to look, like this, and that's why they get butchered. Do you encounter like unreasonable expectations, or like what do you see that patients
Sure.
think?
I have unreasonable expectations all the time. The difference is, and this is where you have to become empathetic. So you have two ways of dealing with that. Someone could come in and go, I'll pay you anything. I want to look like this. Now in your head, it's physically impossible, right? But if you want to make some money and it's a big celebrity, you don't want them to go somewhere else. So you go, sure, I'll take your money. They have unreasonable expectations. I'll do as best as I can. We'll see how it goes. But at least I made a lot of money, and I could say I operated on a X big shot so I can brag to my friends. That's one option. Or you can do this. You can say, those are completely unrealistic expectations. There is no way I could ever achieve that, and no one else can either. I do notice that your brow position isn't great, and I can help you with that without these risks. And if you're interested, I can go through some other things as well. this is the only way you can do it. What you're suggesting is completely unrealistic, and if you ask enough people, you will be harmed. I hate to tell you this. Those are. I know you're a big star and that you're used to getting your way, but you cannot. That's how I deal with people who are not A-list celebrities. As a matter of fact, I never have A-list celebrities. I deal with but in this modern world, we're all big shots and pseudo celebrities.
Well, so what about, regular patients, regular people? What are the reasons they tell you they want plastic surgery, maybe the most common ones? And what does that tell you about people?
I think it's really interesting. I love the human side of it, and I love learning about people. My main interest is rhinoplasty or nasal reshaping surgery, but I also do some injectables. And I think that rhinoplasty is one of the most important procedures, and it's most interesting. The nose is vital to how we breathe and sleep. It's really the center of our structure of our face, and I think it's the area where it can make someone look bad as a young person, and they can have a lot of problems with self-confidence because of a bad nose or a crooked nose, and it can really turn their life around.
What are the most common reasons people have for wanting plastic surgery? And what does that tell you about people and what they think?
I'd say the most common reason, going by what I was saying about rhinoplasty, the most common for a major surgical procedure like a rhinoplasty is that it impairs their day-to-day life. In other words, they feel self-conscious about their nose. I just had someone in with me yesterday. So they're always worried, even to have people to see their profile. Like they don't like to sit at certain angles. They hate looking at selfies. They hate looking at pictures of themselves because they don't like that view. A lot of times that goes hand in hand with they're not breathing well, and they have even some sleep trouble as a result. So they end up, usually by the time they get to me, because I don't market too well or too heavily, I slipped and actually probably said the truth. By the time they get to me, they're kind of struggling with their self-confidence, with their breathing, and they're pretty desperate to be doing better with their nose. With aging patients where I'm doing Botox or fillers or facelifts or things like that, they tend to be more mainstream people who just want to feel better about themselves and are dealing with the pressures of the world to not look aged or tired.
Is there a certain age at which people want plastic surgery? Is that age changing? Like, what are some of the trends that are happening now that you're seeing?
Question. People are more aware of it at a much younger age. Even kids in high school are aware of the whole thing, whereas I feel like my generation was much more innocent. You weren't even, unless you had some real bad deformity, it wasn't on your mind. It was something like parents did. Now I notice even in high school, if I am speaking to a high school student, they're very knowledgeable about what's involved and how it's a big deal. So I do think the age is trending younger. That being said, I think the way that the previous generations, like a baby boomer, would think of, or even the previous generation, the older generation than that, thought about facelifts, they kind of had this whole philosophy like, when you're 60, you go to a good plastic surgeon and get a facelift. And I feel half those people look horrible. And I think people my age, mid-40s, 50s, are seeing some of those bad results and are trying to find tasteful alternatives.
Okay, very good. So why, by the way, do you focus on rhinoplasty more than other modalities? What is it about it that attracts you to it?
It's always what's been most interesting to me, and that's what I do research at the Albert Einstein College of Medicine. That's where I know Steve Park. A lot of my research involves where sleep and rhinoplasty, kind of where beauty, aesthetics, and structure, facial structure meet. And it's been a really interesting 10 years of meeting people like Steve Park, who was the sleep guy who introduced you to me. I see that rhinoplasty, it's not just about the bump on the nose. It's literally It can even be a critical health issue related even to cardiovascular health, overall age, and mostly it relates back to, are you a nasal breather or are you a mouth breather? And a lot of times the people who are mouth breathers, their nasal aesthetics are poor. A lot of people who are nasal breathers, they have good nasal aesthetics. And you can tell, I can spot based on their jaw and nasal structure and how these things are related. And the mouth breathers, as much as we think of it as like a stigma, like, oh, it's a sign of not intelligent, that's not true. It's actually a sign of respiratory problems during sleep, which means people don't get as good rest, and they're more prone to things like sleep apnea. So the conventional wisdom is a rhinoplasty surgeon or a plastic surgeon has nothing to do with sleep or sleep apnea. But from my research and quest, it has everything to do with it. But it's also related to the shape of the jaw.
Okay, I see what you mean. So, right, the rhinoplasty is not just for beauty, but it's literally for being able to sleep better without apnea or upper airway respiratory syndrome or those kinds of things.
Correct.
Makes sense. Okay. Is there a name for plastic surgeons that will do corrective work like this? You know, it is plastic surgery, but it's not. It's not for looks, really. It's more for function. Is there a name for that?
Yeah. I mean, the procedure is just like you said, functional rhinoplasty. Most people like me are what's called a facial plastic surgeon. So I did a residency in otolaryngology, or ENT, and then a fellowship in facial plastic and reconstructive surgery. Most people who are really interested in rhinoplasty did this route of facial plastic surgery. So I do no body plastic surgery, and I'm not qualified nor certified to do that type of thing. Most people, when they say they are a plastic surgeon, they did their prerequisites in general surgical fields and then fellowship or residency training in plastic surgery. And that it's two different board certifications that are by most boards considered equivalent. But so it's a different field. So I'm what's called a facial plastic surgeon, even though you might have assumed that it was a subspecialty of general plastic surgery or full body plastic surgery.
Yeah, I guess even naming it, it would give people a better idea that, you know, you're not just there for beauty, that you're there for functionality, and there's all these other things that they may not even have considered.
Yeah. I've toyed, you bring up a great point. I've toyed with the idea because of that association with the bad celebrity stuff. I spend half my time trying to talk people, all right, you don't need to be scared about it. No, you're not going to turn out like Michael Jackson. These are the things that I talk about, and they're unrealistic fears. I understand that they're real fears, but they don't understand the analysis of what happened with Joan Rivers and Michael Jackson and how these things are prevented. So I've often toyed with the idea of kind of coming up with a new name for what I do so that I can help the right people and not elicit fear. So example, you go, oh, I'm going to a plastic surgeon. People are nervous just talking to me sometimes because they feel like maybe some of these bad results will ooze onto them just by even being in association with a plastic surgeon. Sometimes I like to rename it facial architect or something like that, just to, which unfortunately doesn't stick because if I went out and put up a sign that said facial architect or, something like that, or aesthetics engineer or something like this, people go, what the hell is that? Or heck, sorry, I hope I didn't ruin your...
Right, okay, makes sense. Well, very good. So what's the best way for folks to get in touch and to find out more? I know you can't help everybody, but it sounds like, even talking to you will definitely put them in a better direction or looking at some of your resources. So what's the best way?
I have, for my private practice, I'm in Connecticut in Westport. The office number is 203-227-1826. If they're interested in collaborating more in the university setting and interested more in the research and the intersection of how rhinoplasty and facial aesthetics and mouth breathing and sleep all interact, my work email there is howard.stupak@nbhn.net.
Yeah, and actually, a quick question that came to mind. If someone does have sleeping problems and it does involve, working on their nose, doing some kind of rhinoplasty, do they tend to say, oh, well, while you're in there, make my nose look better? Or, can you do this surgery in such a way that they look exactly the same, or does it have to change their appearance?
It's a great question, yes and no, and it really is variable. So in other words, if someone had a horrible nose that the structural problem was causing the problems, and they said, I want to look better but don't want a drop of change, I'd say, well, then we shouldn't do this because we're not going to achieve anything. If someone says, I want you to preserve my look, I don't want to have a rhinoplasty look, not that I ever want to do that, but I don't want to look much different. I want you to preserve my features as much as you can, but of course not compromising my breathing, then that's a reasonable expectation, and I will do my best to achieve that.
And are there any traditional nose shapes that lend themselves to, problem sleeping or not, like a Roman nose or any other kinds of noses that seem to be better?
I'm probably less familiar with the lay or, the non-specialist version of them. But the most interesting one that I notice is something called a tension nose. I don't know if the public is very aware of this. It's where the nose kind of really sticks forward and almost, it has a bump to it, but it's also kind of the lip is kind of short because the nose is long. It's really, I guess another word would be the very prominent nose. Those people tend to not realize that they have a breathing problem, and just reducing the size of it and matching it to the face, they get a tremendous improvement in aesthetics and breathing. And a lot of times they people who came for the aesthetics didn't even realize that they weren't sleeping and have sometimes life-altering results.
That's nice. Maybe if someone comes in for, I guess to put it gutturally, a nose job, if you could also tell them that, hey, this may improve your breathing and sleeping at night, that's an added benefit.
Yeah. You know what? The way I start maybe 10 years ago or 12, 15 years ago, I was mostly interested in just the aesthetics. I mean, hey, who wouldn't want to focus more on the making money side and making people pretty? It sounds more cool, and that was what I was trained to do. But one of these people, while they were, about 6 months after their surgery, she had a good result. But she said, I have to tell you something. I don't know if you ever heard of anything like this or if this sounds weird, but, before the surgery, I never experienced dreams. And since then, I've had dreams, vivid dreams. I've only had vivid dreams. Then my first instinct, especially as a doctor, is, it's not possible, or you must have imagined this. But what it did is it led me to this quest of being like, wow, I wonder if this stuff, there's more to it than just aesthetics. So, everyone knows there's more to it than just aesthetics. But I think the functionality grows deep, and that this change in dreams, and I noticed her whole life had changed after that. I'm not necessarily all for the better. She became a much more adventurous person and changed in very substantial ways. And the more my eyes were open to that, the more I learned, and the more it has informed my research and reading, and really by keeping an open mind and listening to patients, I've grown a tremendous amount beyond what my training was.
Yeah, no, that's great. That's a great evolution.
Yeah.
Well, very good. Well, Dr. Stupak, thanks for coming. And, it's really interesting. I think listeners will definitely benefit from this. And, again, the most difficult thing is to find someone like you if they're not in your neighborhood. So I think you give them some good ideas on how to do that. Yeah.
It is a hard thing. Use the human skills.
Well, very good. Well, thank you for coming on the podcast. I appreciate it.
Thank you for having me. I appreciate you having me.
All right, hold on a second.
You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you.